Hi, my name is Emmanuel Cruz Carrasco. I'm going to read Chapter 9, Hospital, from the textbook Professional English Use in Medicine. I'm going to read the theory and exercises. Chapter 9, Hospitals. A. Introduction to a Hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron, the Royal Infirmary, is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the hospital for sick children. You can see some of the departments in our hospital on the sign. Of course, there are many others, for example, the intensive care unit ICU and the surgical high dependency unit HDU. Jordi, what does outpatient mean? Dr. Barron. Outpatients are the people who come to hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for one or more days. The rooms where they stay are called wards. If a patient's treatment requires only one day, such as a simple operation, they can be admitted to the day surgery unit. Here we have the sign of the Royal Infirmary. In the video is mirrored, so sorry for that, but you can see all the departments. I'm going to begin reading the sign. Welcome to the Royal Infirmary. South entrance, car park C and D, visitors and staff. The Simpson Center for Reproductive Health. Gynecology, emergency. Maternity, emergency. Neonatology, emergency. Outpatients departments. R wards, day surgery unit and endoscopy. X-ray department. Combined assessment. B. Outpatients. Dr. Barr. The accident and emergency department A and E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by the GP or general practitioner, who writes a referral letter to the consultant explaining the patient's problem. C. Inpatients. Dr. Barron. The inpatients in a hospital are admitted in one of three main ways. They may be seen in one of the outpatient clinics and admitted from there, or, if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill, for example, with suspected myocardial infarction, or they are seen in the accident and emergency department, where the doctor on duty working at that time arranges the admission. This will happen in the case of a patient with a fractured neck or femur, for example. Larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi, assessed? Dr. Barron, yes, decisions are made about the condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Now I'm going to read the exercises. 9.1. Complete the table with words from A, B, and C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, admit. Verb, assess. Verb, discharge. Verb, operate. Verb, refer. Verb, treat. Noun, admission. Noun, assessment. Noun, discharge. Noun, operation. Noun, reference. Noun, treatment. 9.2. Make word combinations using a word from each box. Look at C opposite to help you. The words in the boxes are, in the first box, acutely, assessment, on, referral, waiting. In the second box are unit, letter, list, duty, and ill. The word combinations are on duty, acutely ill, referral letter, assessment unit, and waiting list. 9.3. Which hospital departments will be most appropriate for the following patients? Look at A, B, and C opposite to help you. 1. A woman in a diabetic coma should be in the inpatient or in the all wards, or in the constant assessment, in the combined assessment. 2. A patient who has just had a radical prostatectomy is in the surgical high dependency unit, or ACE HD. 3. A patient who is to have a skin lesion removed is in the day surgery unit. 4. A man with a foreign body in his side is in the accident and emergency department. 5. A woman with a threatened abortion is in the emergency gynecology, maternity, and neonatology of the Simpson Center for Reproductive Health. 9.4. Complete text extract from an information leaflet for patients. Look at A, B, and C opposite to help you. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you. Check your details and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to have some tests such as an x-ray, which will mean going to another department, or you may have referred to other professionals such as physiotherapists or dietitian. You may need to revisit the clinic if staff at the clinic want to see you again. Another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for their day surgery, you will be told when this is likely to happen. If you do not need further treatment, you will be discharged to your GP's or general practitioner's care. So that was the chapter 9 hospitals of the textbook Professional English Used in Medicine, the exercises and theory. Thank you very much for watching this video.